Hi, everybody. We are back talking about great things in ERP. Today, we're talking about the touchless contract of payment, and it's really all about the innovation of supply chain processes. I'm Diana Van Blaricom, and I'm the Vice President of ERP Strategy here at ROI. And today, we're going to talk about automating some of your processes and really getting to that touchless environment. We'll do some quick introductions because I have a subject matter expert with me today. We're going to do a couple quick audience polls. I know you guys are just listening, but we've got some great things for you to think about as you make this transformation. And we're going to get into the details of what is the touchless process. When it comes to Infor Cloud Suite, that's where you can really leverage some of this leading practice. And we're going to talk about the pieces that make that work. And then at the end, we're going to give you an action plan to help you get there. So hang with us. A little bit about ROI. If you have listened to us before, great. If you're new to ROI, we have really three pillars to our organization. The first and foremost is our Infor ERP practice, where we have a group of seasoned experts that are all certified on the Infor applications. And we've won numerous class awards over the years. CLASS is an organization that kind of ranks and certifies implementation partners, and we're very proud of our ranking in 2022 as the Best in Class ERP Implementation Leadership Award. So some other things that we can do for you if you're in healthcare, we also have an HIS practice, so we do things around Epic and Cerner, those implementations and some of that legacy support. And then, of course, for the backfill that you might need on these projects, our team of recruiters in the resource group can help you find that skill set and talent that you need. So a little bit again about CLASS. We are very, very proud of this. We take this seriously. We've won numerous awards over the years, and this really goes to the quality and passion that we work with our customers every day. And just a few of those customers, folks that we like to consider that are in the ROI family, you can see those here. So quite a broad reach. We have been in business since 1999. We grew up as a project management company and started the Infor practice in 2010. So been doing this for a very long time and have a great number of folks that are in our family. So once again, I'm Diana Van Blaricom. I'm the Vice President of Sales and Strategy here at ROI. I have been in and around ERP for almost, well, over 30 years. It's more than 10, right? And joining me today is Lynn Hamrick, and Lynn is our Director of ERP Finance and Supply Chain Services here at ROI, and she is going to walk you through a lot of the touchless process. We're going to talk about what customers like yourselves can do to optimize the applications and give you some ideas on how to really get to that touchless process. So welcome, Lynn.
Thanks, Diana.
All right, I'm going to let you walk everybody through what exactly is the touchless process.
Okay, great. So utilizing delivered functionality from the Infor applications and following leading practice, we can get you to a touchless process from the procure to pay cycle. So starting with the supplier portal, the vendor can register to become a partner with your organization. They can submit a vendor application, submit their W-9s, and eventually when they do business with you, this is also an avenue for them to submit their invoices electronically. They can log in and check the status of their invoices, check their payments. All of that can be done without having to reach out to anyone in your organization. This feeds right into strategic sourcing, which is another application that your organization can use to post bids for suppliers to respond to. This then will feed the responses to your bids back into contract management, which once the vendor's selected, it will build the contract for you in contract management, totally electronic, no touching, and uploading that contract so that it's available for the end users to create requisitions utilizing that pricing that you just uploaded. So requisition self-service is the tool that those end users will utilize to create the requisitions. The requisitions then follow an electronic approval process that's tied to your HR org structure, so that, you know, it's tied to the position, not the person. So if someone leaves your organization, you don't have to worry about updating all these manual flowcharts or spreadsheets to route the requisition approval to the appropriate person. Next, Once the requisitions are approved, then POs are electronically created utilizing the automated jobs that are available within Infor. And then the POs utilize EDI and transmit directly to the vendors. The vendors then communicate back through EDI, sending your electronic confirmations. And if you choose to update your POs using those 855s, you can do that automatically within Infor. Then if your vendor has the capability to utilize the 856 transactions, that can create a receipt within Infor. And then they can also transmit an 810 electronic invoice. Invoice comes in, gets matched, auto approved and paid through electronic funds transfer. So that's the process end to end. There's no paper, there's no touching. If all of your data is accurate, this is a completely touchless process from the time a supplier requests to become a partner with your organization through making a payment to that vendor for the services or products that they provide to you.
That's fantastic. I mean, that we're really talking about getting rid of those manual human touch points, saving time, right? Time is money.
Right. Saving time and, allowing your staff to spend more time on more value added tasks. I know when I was in a role as a supply chain leader, they're always asking us to do more with less. And this was very beneficial to our organization. Getting up to 85% of our transactions to follow this process was very beneficial. Obviously, the key to all of this is getting your master data cleaned up and making sure that you have a governance process in place to maintain it going forward. Because, garbage in, garbage out. If you do not have clean data, this process is not going to work. This, entire touchless process will eliminate countless hours of effort in managing downstream errors between yourselves and the vendors. And as long as your data is accurate, all of these transactions will flow through seamlessly.
Yeah, and I think that's a big key piece of it, right? I know we work with a lot of our customers around data cleanup and those things,
Right.
Which is kind of the precursor to this. It can be either part of a project or, if you didn't get a chance to do it as part of your project, you're kind of backing into it after go live. But so critical to have that data governance. It's true with any application, right? It's only
Right.
as good as how we use it. So I think the first thing that what our viewers can really think about is, are they requiring a PO for every purchase that they make, right?
Right. And a lot of times that takes a change in current policy. That's probably one of the toughest things when we're dealing with our customers on implementation is like, this is a big change management issue. Because a lot of folks have, been able to do whatever they wanted with credit cards or, running out to the store to buy what they wanted and then submitting receipts. So this is a big change management effort.
Mhm. Yeah, but definitely needed. I mean, we've seen customers that get invoices for, $1 million piece of equipment and there was no PO who
Right.
authorized it, right? So
Right.
it's really about just putting a good solid process in place. And I think it's important, even more important today with what's happening with inflation and the economy and just really, inside of these organizations, the healthcare um, organizations are really watching budgets, right?
Correct.
So
Yep.
yeah. So, Lynn, talk to us about the pieces that really enable this process. And I think it really bodes to just setting the system up properly.
That's correct. So, I mean, contract management is a key piece of this, making sure that you have your terms with your vendors, obviously your pricing, if there are any, discounts based on volume, tiers on your contracts that are available, all of your contracted items, your distributor contracts set up correctly, and also taking advantage of that GPO interface to keep your GPO contracts up to date. Those are all essential in making sure that your pricing is accurate. And then you take a look at inventory management. The key thing here is your item master, making sure that anything that is on a PAR or perpetual inventory has an accurate item master record, that you are utilizing standard nomenclature, that your units of measure are accurate, and that you have pricing loaded on a contract for all of those items. making sure your reorder points are accurate and that you're using the automated inventory replenishment. So, you don't have somebody that's going in and manually putting in orders, that you're utilizing the system and taking advantage of that automated inventory process that's available. And then in purchasing, we kind of talked about this already, using electronic requisitioning for all purchases. Make people put the requisitions in. Don't take paper anymore. It's way past time that supply chain accepts paper or phone orders, or make them put in a requisition. Enabling workflow for routing of approvals, we've talked about that. And then where you can automate a PO assignment and release and send it out to the vendor without any kind of buyer intervention, take advantage of that. Maximizing EDI transactions, anywhere where you can take advantage of a vendor being able to accept or send all of the transaction sets, take advantage of that. And then, of course, working with accounts payable for invoice automation, including the auto matching and utilizing APIA and all of the tools that are available within Infor. And then, of course, our vendor master records, making sure that we have complete tax ID information, that we're setting up parent-child relationships to stop the duplicate vendors being allowed to add to the system. Setting that up correctly, especially utilizing the supplier portal, that will stop a lot of the duplicate tax IDs because it will not allow you to add them if you start at the supplier portal with adding those vendors.
And Lynn, you said one thing that I think is really important is going paperless, right? Really getting people to get away from that paper process. And a lot of people might be thinking, how do I do that? Well, we can do it with this, right? So we're going to talk in a little bit in a minute about Infor Go and show a few examples of what it looks like. But if we're talking about really getting rid of the paper process, we can have people do it from here. They can request and do POs right from their phone, right? Through Infor Go. So we'll show a little bit of that as we go forward here. All right. You want to talk a little bit about some key features of contract management?
Sure. So this is one of the contract management dashboards. So this gives you, some quick links to, manage your contracts. But the key things on here are, active, expiring, and expired contracts. So this gives you, these are the things that I need to focus on right away. These are my contracts. See, you can see in red, they're expired. So anything that's on that contract that doesn't have a new contract that's been built, there's no pricing going to default from anywhere on those items. So those are things that we need to make sure somebody's working on. You can also see where we've got a list of all the contracts and then their effective and expiration dates here. These are things that are easy to pull out, and you have information at your fingertips.
Yeah, and I think we find a lot of customers are dealing with the traditional process of having contracts in drawers or a shared file somewhere, or at best on a SharePoint file in a folder somewhere. Here, if we have it in the system, we can actually have the system do the work and alert us. We don't have to be proactive and say, hey, when is that expiring? We let the system tell us, which is
right. And we can also send, emails, not just have it on the dashboard. It can automatically send emails. And then you can also, using, IDM, have the actual documents attached to the contracts within contract management. So you're not looking in a file cabinet or, some SharePoint site or whatever. It's all right there attached electronically. Yes.
That's great. So let's talk about pricing, because again, going back to the economy and what's happening with budgets in these organizations, we really want to put some processes in place that help control the spend, right?
Right. We're always hearing about rogue spend, right? So we have a way, even if the item is on contract as a special and you don't have an item master record, if something's on contract and I want to drive the spend to that contract, I can flag that item as a preferred item utilizing that preferred line that's circled right there in the middle. And when someone is going into requisition self-service to requisition an item, those items will come to the top of the screen when they're searching for an item. So for example, if I've 10 gloves in the system and they are searching for a glove, the preferred line items will come to the top when they enter that search. So we know, 9 times out of 10, people will pick the first one that they see.
Right, right. Yep, and there's that little flag right there. So if you're currently on Cloud Suite and you're looking for that flag, there it is right there. Okay, so here's the other question that I think people can ask in their organization. And really, hopefully, we're just giving you'll notice the little key in the bottom right-hand corner. These are some key things to think about. And maybe go back and again, ask those questions inside your organization. Are your supply orders submitted electronically? So talk to us a little bit about that from an inventory perspective.
So like we were talking about earlier, utilizing the system and using the automated inventory replenishment. And so instead of focusing your time on, entering requisitions or handwriting orders and all of those things, you can take the time that you're spending to do that and address your exceptions. So work on your zero stockouts, work on your items that are below your reorder point, work on your substitution items, those sorts of things. So you're spending the time following up and expediting items instead of manually placing orders. So utilize the system. You can do this all from your handheld. You can do it from your mobile device. Anything that you can do within the application, you can do on the Infor Go app. And a lot of folks are starting to take advantage of this and are getting a lot of value out of it because I know the handhelds are expensive that we use with mobile supply chain, but this can be done from any kind of phone or
Your
even
smartphone.
from a smartphone. Yeah, any kind of
Yeah.
smartphone.
Yeah, and you'll notice the little logo up in the right-hand corner at the top there. That is the Infor Go logo. So if you want to go out to the App Store and take a peek at the app, that's actually the logo you're looking for. There's a little bit of setup, but really it's nothing to really set this up. And I think that's the crazy thing that people don't realize. You'll spend more time writing the email to send out the link to people than actually deploying this. There's a QR code. Your tech folks can get into the administration console. There's a QR code that enables it. You scan the QR code and it sets everything up, and then you use the same credentials that you use to log into the desktop. And so anything you can do from your desktop, you can do on your phone. It's just you have a little bit more streamlined user interface because you're on a smaller piece of real estate, but it does follow that same security protocol. And sometimes I would think it even makes it a little bit easier.
Yeah, you could also requisitioning. I mean, this is real popular, especially in our hospitals that have a lot of clinics where, they don't have time to sit in front of a computer because a lot of times you've got the same person who's checking in patients is also the same person that's reordering supplies. So they can pick up their phone and go into either the supply room or the individual patient rooms and be able to create a requisition for the supplies that they need. They can also do their receiving on this phone. So, Infor goes very, very helpful for offsite areas and that sort of thing.
Yeah, I think it's great. I mean, truly, mobile device, the whole concept, but I love the idea of just pick it up and go in the storeroom.
Right.
Right there with you. Let's talk a little bit about, for those purchasing folks, what their dashboard might help them with.
So especially, a purchasing manager needs visibility to what needs to be done across the board for all the buyers. So a buyer dashboard is going to be specific to that one person, but the manager dashboard can see like all unreleased POs. So, if somebody's out, they can, get somebody else to cover for releasing their orders for the day. They have visibility to all the expiring contracts, even if it's managed by a contract manager, they still have visibility to see anything that's expired that needs to be worked on. They have visibility to all the open PO lines that are past their expected delivery date. There's also additional widgets that you can add here for open cost messages. So anything that purchasing manager needs visibility to across all buyers, that's what would be visible here, but then the individual buyer gets to see all of just their specific transactions.
Yeah. And to your point, they can keep things moving if someone, it maybe is off for the day or out sick
Right.
or whatever. They've got visibility into keeping things moving.
Right. And
And
they can also see this on Infor Go.
that's right.
And from being in that leadership role myself, I've, been at home on the weekend or at night and somebody call and, I have an emergency, I need a PO. I can create a PO right from my phone and not have to go log into the system or God forbid, have to drive back to the office. So
Yeah.
N4Go can be really helpful in that situation as well.
You might be out to dinner with your spouse, right?
Yeah, you never know.
Well, healthcare doesn't wait for us when we're having
Nope.
a personal event, right? But it's a great way to, again, to your point, just keep things moving if you do have that need where you need to log in. All right, let's talk a little bit about the GPO side of it, right? So again, coming back to contract management, go back to your organization, find out if you've automated that interface with the GPO so that you can update the contracts. Let's talk a little bit about what that means.
So there are delivered interfaces with the major GPOs, Vizient, Health Trust. I know they're working on one with Premier, and GHX has one to send information back from their CCX tool that they have. And what this does is it updates the contract information that you have for all your manufacturer contracts. So you can choose to bring the data in and just automatically update it, or you can review it and choose what gets updated. It's totally up to you. It will provide reports on what it's going to update, and then you can schedule this to run on a weekly basis, a nightly basis. That's totally up to you on the schedule that you put together on how you want to do this. So, and it can be automated so that no one has to touch this as well.
That's awesome. But the important thing that you said was it's delivered, right? So
Correct.
for a lot of organizations that maybe are managing a custom interface at this point, you could take advantage of this and move to it so that it's not only developed in a standard manner, but it's delivered and supported by N4, which I think is huge, right? So we get out of the managing a custom interface. If you're going down the path of an implementation, or you decide that you want to take a look and maybe do an audit of what you're doing today and you don't have these implemented, again, you're going to find those available in the interface list and be able to take advantage of those and maybe start remediating some of that custom stuff. All right, we talked a little bit about the front end side of it now, where we're talking about those back office functions, right? It's the buyers and the people are requisitioning and we're approving POs and all of that. Let's talk a little bit about how things move over to the patient charge, right? The revenue cycle side. So another thing that we can have people do that brings a lot of value, like what are those high value efforts that they can do, is to clean up the charge master, right? Standardize across all your facilities. So this can be, if you're a large organization, this could be a little bit of a daunting task, but so important. So the next thing you can do is say, hey, what are we doing with our charge master? Are we using the same one across every facility? All right. So here's an example of why and where that's important. So you want to go to standardized codes, right? And these are just some examples of some of the codes that you'll use, but we're going to show you in a few minutes the process and how it all connects. But you need to be able to make sure we have that standard set of codes. And when we have them defined both in the ERP and the EMR, that's how the two systems are talking to each other. We're going to show you a little bit and talk a little bit about Clinical Bridge, which is an important piece of delivered functionality that gets those two working. So we'll show you that in a second. All right, this is what Clinical Bridge brings to the table. So when we think about connecting the ERP to the EMR, we're talking about not only a group of delivered interfaces that are HL7 compliant, we're talking about delivered functionality. Again, this offering sits between Infor Cloud Suite and your EMR. And it's not only a product offering, but it's a service offering. So if you think about whether Epic or Cerner were to make changes on their side, or Infor is doing updates, right? Constantly evolving the software. When you have Clinical Bridge, these adapters are kept up to date by Infor. So if the EMR changes something or Infor changes something, you don't have to worry about maintaining these interfaces. It's completely managed as part of the service by Infor. So here you'll see the list of the file that goes outbound from contract management, inbound and outbound from supply chain, point of use, right? So we've got some happening there too. And then you've got your patient revenue and your patient refunds. Those are the two pieces that you do build. But again, this is key. You do not have to be maintaining these interfaces on your own. You can talk to your Infor rep about the license for this, and then the service itself, it's definitely going to be a lot more affordable than manually maintaining these on your own, especially with the way software development's happening these days, right? Things move. We want to see that new technology coming.
And Diana, one of the key things there is that we no longer have to maintain all the items that we want to go across to our EMR in the item master. With the new functionality in contract management, we can flag those items to go across on the interface right from contract management without having an item master record.
Oh, that's
That
perfect.
is huge.
That's huge, right? Again, back to that streamline and automation. Right. All right, so Lynn, let's talk folks through some of these processes and where Clinical Bridge sits in the middle. In this example, we're talking about the item charge flowing back to Infor when the inventory needs to be decremented, right? So you have your record, we're using materials, it's going to get picked up by Clinical Bridge. We'll come back to the middle box there in a minute because I want to talk about the timing of this too. It creates the pick ticket in Infor, and then your inventory is decremented. One of the things that we like to ask our folks is how often are you updating different pieces of the system, right? So when we talk about these different events and the automation, I think it's important to think that in some cases nightly is not too frequently, right? I mean, here we want to keep our inventory up to date. If we're, a large organization and we've got a lot happening, we may want to do it twice a day, but typically we see at night coming back. But here's the question, right? How often are you guys updating your charge master? Are you doing it once a quarter? I mean, we've had clients that, haven't done it in a couple of years, maybe once a year, monthly at best, weekly, right? When you use Clinical Bridge, you could actually do it nightly. And think about how inflation is affecting the cost of things these days, right? It could be as frequently as nightly and nobody has to touch it. And that's really the question that you have to ask is how often are we doing this and are we keeping it in sync? Because if we're not and prices are going up, we're actually leaving revenue on the table when we do that patient billing. So very important piece of that. So here's the process that works through for the charge master and where Clinical Bridge sits in there. Again, we're going to recommend doing that nightly. Your charge master specialist is going to do their updates. It's going to send the item through, right, with all the information that it needs. The specialist is going to add that item to the item master, include your CDM number, put those pieces that are required that we showed you earlier in this presentation on the information within Infor. Contract manager is going to build their contract pricing, make sure everything's squared away. Clinical Bridge picks it up, does its thing, passes it over to the EMR, to your revenue cycle piece. You're going to reflect that new item and the correct pricing, right? That's the important piece of it. And then that item is available to be used with the correct pricing. And I think that's the big thing is we've seen people that, we've had some folks that had clinics they acquired and they learned that they hadn't updated their pricing in many years. And so definitely a huge impact on their bottom line to be able to get that to current. All right, I'm going to let you talk about point of use because I know this is kind of your baby here. Talk to the folks about the charge master to the billing and point of use. I know a lot of folks may or may not use point of use. Should they? Let's talk a little bit about where this fits in.
Okay. So utilizing Infor point of use. So you are building basically a PAR location, and that turns into a point of use, cabinetless point of use. So when your clinician takes an item out of the inventory to use it on a patient, for example, like an IV start kit, they are scanning that item and charging it to the patient all at the same time. And the interfaces with Clinical Bridge are sending a request across to Infor to restock that item, charge the patient, and update all of the clinical records and everything all at the same time. So utilizing Clinical Bridge and Infor point of use can take a lot of the manual processes that the clinicians are doing today and automate those as well, because we are taking away the process that they have to do to reorder the items that they've used, to document in the patient record the products that they've used on the patient, and to charge the patient. So all of that is accomplished just by scanning those items into point of use.
Yeah.
So,
and I think that's important too, because, you know, when we have folks who are bedside and they're taking care of patients, the last thing they're worried about is the pricing accurate on that item, right?
Or
They
is
shouldn't
it
have to.
chargeable, and
Is
all
it?
of those things, because they
Yeah,
just need to worry about, I use this and I need to get it replaced, and that's
the system
all.
does.
Scan
Yeah,
one, I need to get a new one. That's it.
that's it. And everything else happens for them. So I think this is a really important thing, um, that people, if they're not using it today, could add and get a huge benefit from.
Correct.
Yeah. All right. And this is another piece of the whole process, right? Is that contract pricing interfaced over to the EMR? Again, might be a custom interface that you're using, part of Clinical Bridge. Being able to have those automated updates from the GPO. So we have that data file we get from the GPO. I think you alluded to this a little bit earlier. We get that file in, we process it. We can either have it go automated or we can review it first, right?
Right.
So even gives us that little bit, you know, a lot of folks might say, oh, I can't just shoot it in there. I want to look at it first. Great. There's protocols for that within the system. And then, of course, Clinical Bridge will do its thing. It's going to add, delete, change the information that is sitting over in the EMR, and then they're going to process the file to reflect the correct pricing over that charge master. Again, no paper, no manual uploads, and ideally nobody has to touch it. All right, Lynn. So let's talk about, I call it the top, you know, that there's the top 10, the top 5. I think 7's a lucky number. So I want to talk a little bit about what folks can do, what they can go back and ask, right? We've talked about some great features. I think the thing you want to do is go back and ask your team, if you are on Cloud Suite or if you're in the middle of an implementation or thinking about going to Cloud Suite, what are your processes you're doing today? Are there features in the system configured to execute on that touchless process? So if you take a look at the very beginning, as we started out, we kind of gave you that list. And then are you using FSM to achieve it, right? That's where we want to go, is get everything working inside of Cloud Suite, connecting into Clinical Bridge, make sure we're not manually maintaining that data back and forth. So here's your top 7, right? Every purchase requires a PO. That's where all the little keys were in the presentation. That's your list. Supply orders have to be submitted electronically. You want that automated interface that updates the contracts from the GPO. You want a standardized charge master. That's a big one. And even if you do that one, you're going to be, you know, that far ahead. The contract pricing interface, the charge master pricing updated frequently, not once a quarter, once a year. Let's do it a little bit more frequently. And the importance is the compliance and the automation, right? Everything's HL7 standard. It's plugged in, it's ready to go. You don't have to build this stuff from scratch. All you got to do is get with Infor, have them introduce Clinical Bridge, get the implementation done, test, and you're on your way. So I think just one thing we want to leave you with from this session is, if you are interested in learning more about how to create this path to optimization, if you're on Cloud Suite, you know, we can do a quick audit that walks through, or an assessment, if you will, that walks through your current processes today. And we can determine where you have an opportunity for automation. Or if you're planning a project, let's plan your project to be able to do the touchless contract to payment process. All right, for more information, thank you, Lynn, for joining me. Always a pleasure.
Thank you.
So much great information. If you're looking for more information on how ROI can help you, or just more information in general, you can go to our website at roihs.com. You'll find a number of other videos there, other thought leadership types of pieces. The things that we can help you with are not only implementation and business transformation, again, optimization of your current system, the change management and project management on these projects is a big piece of it. A lot of what we do is really around change management and changing our manual behaviors. But check us out. And then if you want to reach out to us, you can click on the contact us at the top, shoot us an email, and we'll get back to you, and we will start getting you on your way to an optimized ERP. Thank you. Thanks, Lynn.
Thank you.